Patient here today, he's been dealing with some bronchitis about a month ago, but he's been dealing with more residual symptoms. So we're gonna go ahead and do some cupping around this area here, around his lung field, and you can see he's some residual symptoms already. So we're gonna see if we can kind of clear it up and then have him feeling a little better.
Sounds good.
Okay, so I'm gonna apply a little bit of massage oil. It's baby oil. Around this area here. Is this your first time getting cupping?
Yep.
Okay, awesome. I'm gonna do a little bit of massage cupping for you, and then if you feel like it's too much section, let me know and we'll go ahead and adjust as needed to what is tolerable for you. But we'll go ahead and warm up the muscle a little bit with the silicone cup. Just nice glides around here. And then once we get it warmed up, I'll go ahead and start increasing, and I'll do a couple different methods today. So we'll do massage cupping, we'll do a little bit of flash cupping, and then we'll also do some silicone cupping too, and see if that can help with some of that residual coughing from the bronchitis. I switch to a smaller cup. You can start seeing the redness, the blood flow coming up to the surface. So flash cupping is when we are getting suction and then immediately taking it off, just like that. So this is another really good method for a lot of people who are dealing with any type of coughing, chest congestion.
Is it normally like one session or is it multiple?
You can do multiple sessions. It just depends how your body reacts to it. I've had some patients respond really well with cupping and not need repeated sessions.
And
Even
how soon do you expect a response? Is it
Um,
right away?
for coughing and congestion, you can try to see if I would give it a couple days to see how it feels. Usually if we're using more cupping for like muscle release and pain, a lot of my patients can usually feel that right away.
Okay.
Yeah. Last, we're gonna go ahead and switch over to the vacuum suction cups.
Okay.
So these have more of a suction. So again, go ahead and let me know if it's too much. We can always adjust as needed.
Okay.
But usually when I put the first one, especially if it's your first time feeling it, you'll feel a lot of intensity from the suction, but breathe, see if you can kind of just let it relax, because then it'll start to kind of numb out.
Okay.
Yeah.
Big hickey.
What's that?
Big hickey.
Yeah. Possibly.
Yeah, that's fine.
Possibly. Yeah. Doing okay so
Oh
far?
yeah. Feels good.
Yeah.
It's not like painful or anything.
Okay.
It's like you know something's there.
Yeah. These tend to be more relaxing than the massage cupping.
Yeah.
And so I usually like to finish these with patients, because then at the end of the session they're feeling more relaxed, more zen, and then sometimes they'll get a little sleepy too. That's pretty common. It helps decrease kind of your nervous system. This here. Okay. So once I have this on, I like to do a little bit of stretching to stimulate more healing. And this will help promote blood flow into the regions, hopefully help clear out anything that's been kind of congested in the lung area. I can usually leave these on for, it ranges from 5 to 15 minutes. If I find that you're getting cupping marks, I'll usually leave them on a little bit longer because it kind of tells me that those areas need more. Yeah. Right now it's okay. We'll go ahead and let these sit, and then we can check back in a little bit. Now, a lot of patients usually say like releasing the cups feels the best. Make sure to drink lots of water today to stay hydrated after a cupping session. And that way anything that kind of came up to the surface will be able to drain out a lot quicker. I also used maximum suction for these vacuum suction cups. So if this area feels a little sore today or tomorrow, totally normal. It's like that first time getting that suction feeling on the skin can make it a little tender, but you can always put a little bit of ice or heat if needed. Maybe more so heat, because that'll also help with the coughing. And that's a little bit of some of the post-cupping protocol you can kind of expect.
I feel like that urge to cough has already gone down a little bit. Like there's always, that sense that you have, like, I have to cough.
Yeah.
There, it just happened, but or because I said that, but it does feel different.
Yeah, you were coughing a little bit less during the treatment too. In the beginning, you were already coughing a little bit more than I expected.
You've heard me all day, Kathy, coughing.
Yeah, it was more today too than it has been the other days that I've heard you. Maybe because I don't know if I was around more and then I heard it, but I was like, okay, yeah, let's get a cupping session in for you. And then I just like to finish up with a little light lymphatic drainage to the lymph nodes in the armpit area. Okay, good. And that's a full cupping session for cough congestion.